So now, Kenya has confirmed 3 polio cases of that were actually reported in the county of Garissa, and I'm talking about that polio case having been detected back in July 2023 this year. That was not the only time that the country detected polio. In June 2023, another doctor and his team were alerted of 3 patients whose lab samples had tested positive for polio. And those are just some of the cases that have been reported here in the country. And so this evening, I want us to talk about polio vaccine and the drive that will be happening here in the country. What causes polio? How can it be spread? The sort of even cultural beliefs that are associated with polio. We want to demystify those beliefs tonight. Good evening. Thank you for joining us here on KTN News. My name is Brenda Zeda Radido. And with me in this discussion tonight, joining us direct from our Eldoret studios, is Senator Harold Kipchumba. Actually, Nakuru Studios, not Eldoret, but Nakuru Studios, is Senator Harold Kipchumba, who's a national polio immunization champion. Senator, thank you for joining us tonight here on KTN News, where we're discussing a very serious conversation on polio vaccine campaign that will be happening here in the country. He'll be telling us more about his involvement when it comes to this polio vaccine campaign that the government, through the ministry and other partners, are carrying out. And also in studio, we have Dr. John Ogange, who is the Health Systems Officer at the World Health Organization. Thank you for joining us tonight.
Thank you, Brenda.
And that clearly, with my panelists, it gives you a clear picture that I have an able-reached panel to discuss to us about this polio vaccine. Let me begin with Senator Harold Kipchumba. Kindly talk to us about your journey in terms of why you decided to become a national polio immunization campaign.
Thank you, Radido. I came to live with polio at the age of 4 years, down in the village of Kaption. Now it's about 6 years ago. And as I grew up and came along to be a leader, in 2013, when there was this polio outbreak in the country, I was a nominated senator, and I thought I could bring the face and the life of what polio does to people. And so I decided, let me come out and be a champion to share with the world the pain of polio, how it destroys people's body and soul. And so I'm here just to reach out to people that we can keep other children away from polio.
All right,
and that's why I'm a champion now.
All right, and allow me to ask you this personal question. Had you taken that vaccine before? And when you realized, when your family was informed that you had polio, what was their reaction?
At my time when I was growing up, I think there was very little medical services available from where I was brought up, in northern part of Baringo. And therefore, I think my mother tells me they had not come across the polio vaccine. But after she struggled with my disease that time, which looked more like a curse or something bad had befallen me, she went all over looking for medication, both traditional, cultural, spiritual, and until she reached the hospital, and she tells me that it was at Kenyatta National Hospital that she was told that I had polio, and there was nothing that could be done about it.
All right, and Dr. Ogange, Senator Kipchumba brings in a very important point right there. about sensitization.
Yes.
Talking about back then when there was no treatments, there was no proper sensitization as compared to now. Yes. Can we say that as a country we've reached that level where every family, even within the interior parts of this country, understand what polio is, they know about the vaccine, and they can be able to tell the telltale signs of polio?
Thank you, Brenda. We've done quite a bit as a country. We've penetrated most parts of the country, but there's still a lot of work to be done, especially to handle those cultural beliefs and even religious beliefs. So, despite the progress that has been made in Kenya and globally, I still believe we still have to do quite a bit. Yes.
And this question may sound very simple, but to someone it's not as simple as I want to put it. But what is polio?
Thank you, Brenda. I'll give a fairly simple answer too, because our target is the public. And polio, in very basic language, is a disease caused by a virus. The virus is also called polio, in full poliomyelitis. We have more than one type of poliovirus, but as at this point in time, through the various efforts of trying to contain polio, we have gotten rid of two types. So it's only one type of the indigenous or original polio that is still circulating. And this is what the public needs to know, that we still have polio despite the many years of those concerted efforts.
All right, and before I bring in Senator Kipchumba, who is most at risk? Because I mean, Senator Kipchumba was telling us about his story,
Yes.
at a childhood age. That is when he got it. The parents didn't know much about it until when they went to Kenyatta National Hospital. So who's at risk?
Thank you again for that question. Every person who has not been vaccinated is at risk regardless of age. But the people most at risk are the under 5-year-olds. And again, in any population that has not been vaccinated, everybody becomes at risk. But in a nutshell, the ones highest at risk are those below 5 years of age.
All right.
Yes.
All right. And Senator Kipchumba, your journey with polio, your parents, your siblings, in terms of now you telling us they had to be educated, they had to know about your situation when you're still at your tender years at Kenyatta National Hospital. Talk to us about it, your journey with polio. How has it been?
I usually start with saying that polio disables people. It cripples the soul. It destroys one's ability to live to full potential. Why? Because at the tender age when you're supposed to be playing around with other children and developing some traits in your life, you are not able to do that.
All right.
It reminds me many years ago that as children are going out to look after goats, going to fetch firewood, going to fetch water, I am left behind. And with time you just look like you are of no use in the family. You become a burden. You look like a burden even at the community level.
All right.
As I grew up, I found it very difficult at the teenage and the school-going age because I couldn't go to the school that was near my home, which was about 5 kilometers away. I couldn't attend to activities within the community, and therefore it affected me. It's still affects me to date. That even as a parent, I would have wished to be riding a bicycle with my sons. I'd be going out, holding their hands, as many other fathers would do. But polio has curtailed all that.
Right. So Senator. So, Senator, allow me to cut you short. If I had you clearly, what you're telling us is it's more about self-esteem, and it's something that you're still dealing with until today.
Yes. Yes, it affects, the sad part of this, it's polio leaves a mark forever, for life.
All
you
right.
live with it until you die.
All right.
And therefore, it's something that if only it could be avoided, and thank God we have the vaccine.
All right.
Polio can be stopped at the vaccination point.
All right. And Daktari, I mean, so here we're talking about how Senator Kipchumba got polio, talking about self-esteem being affected, tender years until today, which is not an easy thing, even for family members.
True.
And just before you answer that question, Daktari, what I wanted to ask you, let me just pick your mind on this, Senator Kipchumba. Your family dealing with polio until today, because right now you're saying, you're painting for us a picture of even you still trying to deal with the self-esteem even at your age. So what about your family members? Are they also champions of polio?
Yes, they are. In fact, this campaign period, I've decided to work with my mother to possibly share a story of having me with polio, and how she had to suffer a lot. Instead of going out to work, she had to stay in to take care of me.
All right.
At times she had to travel very far. My wife too, to date, as a man, even changing a bulb in the house, she has to do that now. There are small things that a man or a father should be able to do. I still can't do because of polio.
All right.
Even turning the tap in a shower, or making some cleanliness up. It's my family members that have to do most of those things.
Right.
So it impacts on them badly.
Right. And Daktari, Senator, just paint for us a picture there of the sort of challenges, people who got polio are going through. He's giving us his own life experience. What is the global situation of polio, and when you draw it down now to Kenya, what is our status as a country?
Okay. Brenda, if you allow me, I'll do a brief overview, and I call it the journey of polio eradication.
Okay.
I've worked in polio for close to 20 years, if I may say that. Now, the World Health Assembly, which is the governing body of WHO, which I work for, through member states, and Kenya is one of the member states, came up with a resolution in 1988 that we have an effective tool in the name of polio vaccine that can help the world to eradicate polio. And as at that time, we had 125 countries that were endemic for polio. Endemic basically means that polio was there throughout. And then in those 125 countries, we had 350,000 cases of paralytic polio, those who are paralyzed. And the thing which most of us don't know is when you see one case of a paralyzed individual, there are another 99 to 100 people who are in the population, very healthy, but they are carrying the virus.
So you can be, what you're telling us, Daktari, is you can actually be a carrier without knowing.
True.
And at what age? Because when we started when we began the conversation, you said the people at a higher risk.
Yes.
Are children below 5 years.
Yes.
Yeah.
If I may revisit that statement before I continue with that background information. the people highest at risk are below 5 years of age.
Yes.
We have children getting routine immunization or vaccination, and they complete the schedule for polio vaccine within the first 14 weeks of life.
Okay.
That is roughly over 2 months. So it is within that period that we are supposed to protect the children, and if we don't protect them during that period, then they are more vulnerable.
All right. All right.
Yes.
All right. So you're painting for us a picture about someone being a carrier without knowing.
Yes.
Yes.
So I just wanted to give you the global pictures you had asked.
Yes.
And given the figures I've given you, I'm talking of 350,000. If you multiply that by 100, you are talking of about 35 million people who are carrying the virus then. But fast forward, in 2023, because of immunization through routine immunization program and these campaigns, which are additional protective kind of mechanism, as of today, we have only 2 countries. Remember, I said 125. We have only 2 countries that are still endemic. They still have the polio virus in the population, and they have only 10 cases. So we have done more than 99.9% in terms of getting to reduce the number of people who are suffering from polio.
All right.
Yes.
And Senator Kipchumba, I mean, you've been enabled differently, if I may put it that way. Allow me to put it that way. Your advice to caregivers, especially those hesitant caregivers who actually feel afraid of interacting with, a child or a grown-up who contracted polio, what would be your advice?
Thank you. The first advice is that it's just information. Once somebody has been affected by polio, it cannot be spread anymore. So it's not contagious from where I am. So the people who have been affected and are lucky not to have died, like me and others who are alive, we are no longer danger in spreading polio, and therefore it should be included and in society and in families, and to be parts of the society. The thing that I would wish to encourage is that where you find people with disability from polio, the best thing for them is to be habilitated and be rehabilitated.
All right. So 2 things.
Inclusion
what you're saying is
society.
two things are really important.
Yes.
You're saying habilitated and rehabilitated.
Yes, rehabilitation and habilitation.
Okay.
Okay, but that is when somebody is already in this bad situation. But I would wish to ask every community member, be the leadership, family, and any other structure, to be in the front line to fight the polio virus in the society.
Right.
And that can only be done through encouraging our people to be vaccinated.
All right.
The sad part of it is that polio affects people who do not make the decision. Children under 5 years do not have the power to make decisions. And the decision makers need to be in the front line to see to it that their immunization is strengthened in the society, strengthened at home, and in the community.
All right. And Dr. Gange, the Minister of Health will be conducting polio vaccination campaign in high-risk counties, Garissa, Kiambu, Kajiado, we have Kitui, Mandera, Wajir, Lamu, Tana River, and Nairobi. Why are these counties, what is making them, okay, apart from cases being reported there, but why are these counties termed as high-risk counties when it comes to polio?
Once again, thank you. We do what is called risk assessment, and there are factors we look for. One of them is the performance of these counties in routine immunization.
Okay.
The neighborhood in terms of where the counties are located physically or geographically. We know the northeastern counties are bordering Somalia. We know what has been happening in Somalia over the years. The health systems there are not working, so children across the border are not adequately immunized.
Okay.
In fact, if I may share this, when the first case was picked in Garissa, it was in the refugee camp. When we did a quick assessment, over 90% of the children in that camp had not been vaccinated. And that goes to prove that without vaccination, the vulnerability is higher.
All right.
Then the other factor is population movement. Garissa and Nairobi has a very close relationship, especially in Eastlands, and to be very specific, Eastleigh.
Okay.
There is heavy population movement between the two. And once something is in Nairobi, we talk of the Nairobi metropolis, so Kajiado, Kiambu is part of the metropolis.
All right.
And areas like Kitui are also along the way. And that is how we decided on the risk status.
All right.
Yes.
And you know, when you're saying a populated area and there's high risk of transmission, some would ask or wonder, how can polio be transmitted?
Yeah, thank you. Again, the first thing I would say is polio is the virus or the germ, in basic language, is only found in human beings. In technical language, we say human beings are the only reservoir.
Okay.
It can only be harbored by the human beings. And the other thing, other than population movement, is it is a virus which lives in the alimentary canal. So, and it thrives in places with poor sanitation. So the virus is fecal-oral, so you must engage in touching that, and through the mouth it gets into the body. And that's how the infection takes off. Yeah.
And you know, someone will ask, vaccine doesn't really, in a layman's understanding or language, the vaccines don't really prevent you from not getting the sickness.
Yes.
So the question would be, if someone would take the child for this polio vaccine during this polio vaccine campaign, how sure are they that 100% if the child gets this vaccine that they will not get polio?
Once again, thank you, Brenda. Now, vaccine is protective, and maybe if I go into the other aspect, polio has no cure. So the only intervention or tool to help our children who are not protected is through vaccination. It is not through one dose. Remember, I talked about the routine immunization, which covers our children from birth to 14 weeks. So they need those 4 doses.
So from birth, you need a dose.
Yes.
Then at when is the next? If you can take us through, Daktari, the stages, because you said from birth, your child will need the polio vaccine. Then at what age are you supposed to take the second, the third, and the fourth? Yeah.
So the first dose, we call it birth dose. The child is supposed to get it within the first 2 weeks after delivery. So birth dose or 0 dose.
Okay.
The next dose is at 6 weeks. The following dose is at 10 weeks. And the final dose is at 14 weeks.
Okay.
And all these are recorded in the mother-child booklet. And through that booklet, mothers are reminded on when to bring their children for the next, scheduled dose.
All right.
So the system is well planned, and if parents follow the schedule, they should be able to get the 4 doses due for routine.
All right.
Now, for campaigns, they are preventive. So what we do with campaigns is these are additional doses to help boost the population immunity, such that if we get people who are not immunized coming into the country, there'll be already a wall, like a barrier. Our children are protected. So even if they get into contact with our children, we will have our children protected, and chances of them getting polio are minimal.
Right.
But in a situation where our children are not adequately protected, and this is a scenario where the coverage with the routine vaccination is low, then if we get people who are vulnerable from across any other place, not just neighboring Somalia, but from any part of the world, and the virus lands in the country, we'll definitely end up with our children getting infected.
All right, that's a good in-depth explanation, Dr. John Ogange, Health Systems Officer at WHO, that is the World Health Organization, and also joining us live is Senator Harold Kipchumba, National Polio Immunization Champion. Time for a short commercial break, but when we come back, we shall still be having this conversation, but we will be looking at the something else in connection to polio when it comes to what if, your child missed the doses at birth, or the second or the third. Is your child still safe? And we also just like to also listen from Senator Kipchumba, whether he'd like to see, what he'd like to see when it comes to immunization of children under the age of 5 during this during this time of the polio vaccination campaign.